This series on health system evolution looks at why technology and data systems play a critical role in being able to design and implement the next generation of healthcare systems. Specifically, we'll look at the move from level 1 to level 2 health systems, the shift from predominantly physician-driven systems to systems where a significant amount of care is provided by a healthcare worker using a digital health tool and an integrated system. So let's start with a technology that you're well familiar with: booking travel tickets. At one time, if you went on a trip, you'd have to go to an expert travel agent. This person would have all the knowledge of which roads, trains, and ships were needed for travel. And we'll call this level 1. Then there came a time when you went to a travel agent, and the person working there wasn't a globe-trotting guru, but a friendly and courteous travel agent who knew how to operate a computer. They would enter your origin and destination for your trip and its preferences, and then the computer would perform the cognitive task and work of finding you the best routes. We'll call this level 2. And now today, if you want to book a flight, you would go on the internet and buy a ticket, or you may pull out your phone and Siri may take you anywhere in the world. And let's call this level 3. Technology enables people of all abilities to raise their skill set and to expand their competent scope of practice. At level 3, the consumer can directly access the knowledge contained within the system. At level 2, a competent user of that technology is required in order to access the knowledge in the system. And in level 1, the knowledge of the system is contained only within the expert personnel of that system, and so the technology is absent. I believe that a significant step in healthcare system design is to move from level 1 to level 2 systems. This is to move away from systems where physicians predominantly deliver healthcare to level 2, where healthcare workers are combined with technology and work in an integrated system. Level 2 systems enable something which is called task shifting to be done at scale. And task shifting is the moving of work that used to be done exclusively by physicians to other healthcare workers. The problem with physicians is that they're expensive and they take a long time to train, and there's a significant worldwide shortage, whereas other healthcare workers take less time to train, are less expensive, and are more abundant. And so task shifting changes the way we consider the design of healthcare systems, and this is particularly important when you consider about scaling systems around the world. Now, obviously, not all the work that used to be done by or is done by doctors can be task shifted, but I do believe that a significant amount of high-value, routine care could be safely performed by well-trained staff combined with the right technology working in an integrated system. An example is Ampath's HIV delivery network, which is built really upon task-shifting models. And we believe that a core component in its success is the use of digital electronic healthcare record tools directly at the point of care, directly within the clinical encounter, running mostly on mobile tablets. And this digital tool, the electronic medical record running on that mobile tablet, becomes the critical link between the patient, the clinician, and the healthcare system. And so let's look at 3 benefits of these point-of-care technologies that enable us to move from level 1 to level 2. The first is clinical decision support. And the big benefit of clinical decision support is the ability to provide clinicians with care reminders, notifications, alerts, and suggestions. Decision support allows an outreach worker to have a higher skill set to care for people in their village with HIV, or it allows a nurse to provide more advanced hypertension care than they could without the digital tool to assist in care. And the hope with buzzwords such as machine learning and artificial intelligence is that breakthroughs in these fields will create algorithms that can then provide even more advanced clinical decision support, which will then enable more safe task shifting, which will in turn expand the competence scope of practice of more healthcare workers. The second benefit, in addition to knowledge distribution with these digital point-of-care tools, is that they enable more reliable data collection compared, of course, to their paper alternatives. And this is important to be able to monitor the health of systems, perform research, and understand and study population health. But a word of caution, these tools work best when used in an integrated network. And this network needs to provide pathways to higher and lower levels of care and to other care providers and services. If used in isolation, these tools both lose their potency, but can also lead to more dangerous and fragmented care. For too many years, the electronic healthcare record has been viewed as a digital filing cabinet, a digital vault to store and to retrieve data. But it's better to view it actually as a conductor, something that orchestrates the many individuals involved in the healthcare system. And this makes the electronic healthcare record more of a road network that distributes knowledge and clinical decision support, and then collects data back up for monitoring and evaluation. And therefore, the electronic healthcare record is really left as the quarterback of care in the system. And this is the high-level ambition of where our digital information tools need to move in order to be able to have the right tools to build the next generation of healthcare systems. I think all of this is particularly exciting because just as many countries leapfrogged over landlines directly to cell phones, I wonder if many countries may leapfrog over level 1 healthcare systems to level 2 systems that are, in theory, more efficient, effective, of lower cost, and scalable through the ability to combine technology with healthcare workers working in integrated healthcare delivery networks.